All right, welcome back. I hope you're having an amazing time so far. Our next speaker is Jaideep Rayapudi. He is Senior SME Healthcare AI at iMerit Technology. Please join me in welcoming him to our virtual stage.
Thank you, Patrika, for the wonderful introduction. And even as I start pulling out my slides and start the presentation, I really want to thank you, AI4, for this great opportunity for just being present here and doing this talk. So let's just see, where are my slides? Thank you. Patrika, I think. Thank you, Patrika, and thank you for the introduction, and thank you, AI4, for this moment that we have here as we all discuss about AI for healthcare, and such a wonderful thing. So I'm going to talk about clinical decision support systems and the paradigm shift that CDSSs are going to bring for AI in healthcare. So greetings from India, and today we will see how CDSS has been a great technological advancement and a demonstration of artificial intelligence in healthcare, but at the same time, how developing CDSS will be changing the paradigm for AI in healthcare itself. Now, the quotation goes that our lives are a sum total of choices that we have made. And every day, our brain makes billions of these choices or decisions. Thankfully, most of them are autonomous and unconscious, and we really don't know what's going on. But these decisions are all based on sensory input, internal as well as external input. All this information, this data helps us to make these decisions. Many of the decisions that we take consciously may not be really life and death decisions, but a clinician has to make many life and death decisions for his patients. And these decisions are always going to be much better, much easier when there's adequate data to support these decisions. So data supports decisions. We really need data. Whether we have to go right or left, we need some kind of data, some kind of information. But then there's a problem. Sometimes there is no data. We don't know whether I have to turn right or turn left. I don't know where I'm going. And the matter becomes worse when actually we are in the dark, when we can't even see clearly where we are going and where we need to go. And the last 2 years have been a great period of darkness, some of the darkest moments of our lifetime, in fact, as we have faced this pandemic with the coronavirus. But even in this midst of this darkness, we see so many people suffering, so many people testing positive for the coronavirus. I see a different positive direction taking place for digital health. Digital health is coming up so fast that in the last 2 years, there has been progress which probably would have taken 2 decades or so in terms of not just the technology being developed, but the acceptance and the approval of digital health, both from doctors as well as from the patients. The story doesn't begin in 2020, does it? The story begins much way back, and we have fantasized, we have dreamt about great technological advancements to take us on immense, great voyages and enterprises. And in the past 50 years, as we look back, as we trek back literally to our own planet, which is now suffering from this plague of COVID, we look back and we see all these advances. And today, when you and I, we are sitting in this wonderful conference of AI4, we can definitely say that we are the people who are boldly going where no one has gone before. So CDSS, what is CDSS? A very rough definition would be a computer system or a software designed to impact a clinician's decision making about individual patients at the point in time that these decisions are made. So as I said, a clinician makes so many decisions which affects the patient. And a CDSS or a computer-based system helps, supports these decisions by the clinician. If you want to classify a CDS, we can classify them in various ways. Roughly, for example, you can classify them the time when the support is provided, uh, when you're dealing with the patient before or during or after a decision requires to be made regarding a patient. Um, or you can classify it if it is an active support or a passive support. Is the data or the suggestions being really pushed to the clinician, or does the clinician have to pull out the information? But somewhat more scientific or a specific uh, categorization would be a knowledge-based system or a non-knowledge-based system. The knowledge-based systems are very simple. They're based on guidelines and protocols. If this happens, then we do this. But when we talk about a non-knowledge-based system, we rely on the huge amounts of data, digital data nowadays, which cannot be really digested by humans, but only by machine learning algorithms into an artificial intelligence model. And of course, it will be very difficult to explain in the short time that we have all these things in detail. And I would request you to look up the links that I will share at the end of my talk so that we can get all these things in detail. So talking more about CDS, how does it really work out? What is the basic component of that? The component are primarily three, and these three are the knowledge base, the inference or the reasoning engine, and the mechanism to communicate. So the knowledge base is coming from the patient data, the history, and whatever complaints that they're telling, the clinical data from the examination. That's the knowledge base. And all of this, including the domain knowledge of the past, of the medical, entire medical encyclopedia, so to speak, the entire library, all of this, which gets into the inference or the reasoning machine, and then able to communicate back to the healthcare user, the provider, or the patient. So this is in general a very simplified way of putting what is a CDSS. Now, when it comes to the functions and advantages of CDSS, in the last 40 or 50 years, we have been able to demonstrate that patient safety has increased a lot by using of computerized systems. Medication errors have come down. It has been, you are able to prescribe, transcribe, dispense, and administer drugs in a much better way using a computerized system. Clinical management is better. Care pathways and guidelines and protocols are able to be supported and adhered to when we are using computerized system. The cost of the treatment is coming down, decreasing inpatient time, decreasing medical costs from in terms of the pharmacy, decreasing test duplication. All that brings down the cost. Great help for administrative functions, very good for documentation and diagnostic support. So actually a diagnostic decision support system where you're actually able to triage and say which diagnostic system is best for this particular situation. Which imaging should I be doing? What laboratory and pathology test should I be sending? But the most exciting component of the CDS, which is happening right now today, is that we are able to bring patients and the entire patient ecosystem into this decision-making process for the patient health. Of course, when we bring in the patient, they bring in all the information, whether it's allergies, insurance, and previous medication, everything, we're able to get to that. So when we are talking about advantages, we also must see some of the pitfalls that are going to be there when we're talking about a computerized system. And fragmented workflows, alert fatigue. While all these are there, the greatest of these is the problem of interoperability, where no two systems really know how to work with each other. And of course, it's quite an expensive system to follow. So when we talk about data, the clinician gathers data with all these instruments on a day-to-day basis. But when they come to the digital data, the good doctor has to rely on so many sources of digital information. So whether it's from physical examination, just by palpating or auscultating, from blood pressure monitors to ECGs, directly from the patient's body, the information that we get, and then the data that we get from imaging, from uh, X-rays to ultrasounds. But the great thing, again, like I said, with the CDSS, we are able to avoid unnecessary imaging, unnecessary exposure to radiation. That has been a great advantage. Similarly, in lab medicine, avoiding unnecessary tests and at unnecessary times, we are able to optimize the best time to do a test or the best test to do at that particular time and correlating with other findings. That is one of the advantage. On the economic or the financial front, we see that while generally the costs are increasing for medical medication, we see that by using computerized systems, we're able to cut down on those costs. We are able to provide better care at lower costs. Now, all these things, what I've talked about, are working together with data from multiple sources, from multiple people, multiple departments, and we're used to this. And this is what I would like to call as a hospital or a system-based CDSS. But COVID has brought a great challenge to us when we say that, hey, you have to be far away. Everybody cannot go to a hospital. We have now come to this concept of your health in your hands. We are not lost anymore searching for which direction to go, because now it's not child's play anymore. It's not child's play because we have these wonderful toys, so to speak, which I would simply call wearables. And these wearables, whether we use them for diagnostic purpose or for therapeutic purpose, they get all kinds of data from our heart, from our lungs. They get data about how we sleep, when we wake up, what we eat, what we don't eat. They get data about fertility, advising women the best time or the worst time. And all this data we can put easily into something called a PHR or a personal health record, whether it is your Apple Health Kit or whether it is through your Google or whatever system you're using. In India, we have this wonderful system called the Digital uh, Data Center for each and every Indian citizen, which is just starting. And we can just access our own digital data. And when we have all these things, whether it's your ECG machine, which is stuck to your chest, or whether it is the refrigerator stocking your ice cream, all these things I would like to call the Internet of Things for healthcare. And when we are talking about IoT, that means data, and there's lots of data. That is the big data. And when we talk about data, this is where I would like to introduce to you about my company, iMerit. And iMerit is a data solution company, not just for healthcare, but we work in geospatial, a lot of work in autonomous vehicles. And what we do in healthcare is in different parts, like in computer vision, whether it's radiology, pathology, or surgery, or we do annotations in terms of the healthcare informatics from real world evidence, from CDS systems, from knowledge mapping. So coming back to CDS, CDS is, if you can put it into 6 different portions as given in this wonderful article, whether we have worked with data knowledge or the inference part, the inference machines and the technology, the greatest advancement which has happened is the evolution of the end user, be it the patient and the doctor. And that causes this whole shift in the CDS, that when in the last many decades, AI was shifting the paradigm for CDS in healthcare. Now, the future, we see that CDS is likely to shift the entire paradigm for AI in healthcare. So the future is ahead. The future is ahead of us. Digital health can change the way medicine has been taught and practiced. CDS is likely to have a great impact on the entire philosophy itself of medicine. We have changed a lot, and we don't rely on physical signboards anymore. All of us have gone digital to find direction as well, whether it's a small classroom where we use a machine to do the calculation. we have gone digital. We are taking the example or of this calculator. We even take a lot of decisions by the help of machines. But the important question is, even when we are using a calculator, it is what we ask the machine, and that will only give us the answer. So yes, good data leads to good decisions. But the question that I want to leave you with is, are we asking the right questions to the right machines? It's been a pleasure talking to you. Reach me, ask me. This is my email ID. You can scan the code and connect with me on LinkedIn. Thank you very much.
Wow, Jaideep, thank you so much for sharing with us. That was amazing. And I know this virtual audience is going wild with virtual applause. Thank you again for sharing with us today. And for the audience, it's time for you to make your way to your next session. Along the way, make sure you accept your connection request and take some time to check out our awesome exhibits. Thanks so much, and we'll see you around.